Good morning. Good morning. Ha. Good afternoon, everyone. Hope you're all doing well. Obviously, I'm not oriented toward time, but I've been enjoying my day. We've had some really great sessions happening, and our last session of the day is just about to happen, and it's a good one. We've been trying to connect with pediatricians, and I've met one who's willing to come up and meet with us and help us brainstorm and connect. So Nicole Bichir is here. She's a board certified pediatrician, and she's earned her bachelor's degrees in psych and in biology. She's also has a minor in French, so she might as well be a librarian because she has lots of different interests. So she gets us. So she's an assistant professor of pediatrics at the University of Louisville. And something cool she does too, not that that's not cool, but something else cool, is she's the director of refugee health at Norton Children's Medical Group, also in Louisville. And so she's going to come share her wisdom with us. She has just a lot of experience and some great insights into how we can just really reach into some areas we haven't been able to get to yet. And Nicole, thank you for being here with us. We just appreciate you taking the time out of your day, and we look forward to learning just a whole bunch from you. So thank you for taking your time to be here. And I just changed you to presenter, so you'd be able to advance the slides as you like, but I am here to help too as well. So thank you. Let's see if she's coming in. Could everybody hear me talk when I was talking? Thanks. Thanks, Sarah. Okay. Let's see. Let's try and turn up your volume some more. What I can see on my.
Good afternoon, everybody. So I'm Nicole Bichir. Y'all can hear me okay?
Yes.
Perfect. So I'm going to talk to you guys today about how to partner with pediatricians, tailor resources specifically for kids as far as literacy resources. So I'm a pediatrician in Louisville, Kentucky. I work at the Norton Children's Medical Group Nulu office. And just for some background, my patient population is really special. I have a lot of diverse patients with a lot of different needs. So one of my biggest patient populations is refugees. And so that means that, again, this is going to be kind of a moving target as far as where kids are coming from around the world, what sort of languages that I'm going to need access to. Another big patient population we serve is kids that are in foster care and that are adopted. And so this is more of a mobile population, again, sometimes with special healthcare needs and special needs related to their literacy. And then also I serve kids that are in residential treatment, and we have a lot of folks who come to our clinic because of access to therapies that have autism. So it's just a lot of really special needs. All right, the objectives of the talk this afternoon is going to be about the importance of early literacy. We're going to talk about reaching kids who are located in quote unquote book deserts where they don't have access to a lot of books. The role that pediatricians can play in supporting early literacy, the impact of partnerships with libraries, librarians, library resources, how you can partner with pediatricians and tailor resources together, and then the next steps for partnerships, which would be along the advocacy route. All right, so the importance of early literacy. There's a critical period of brain development in the first 3 years of life. And just as far as activity goes, by age 2, a child's brain is as active as an adult brain. They're ready to learn. And by age 3, it's even more active, twice as active as an adult's brain. So this is just a critical period of learning. If a child's brain is not stimulated during that early period, learning can be more difficult. They're going to be less successful later on in life. And this is regardless of, having a environment that's rich in books later on if you don't meet that critical period need. If you look at this figure, this is just showing the rate of return to investment in human capital. So the earlier you intervene, the greater the return will be. Prenatal, if you intervene at the prenatal level with programs, that's going to have more outcome compared to waiting until school age. Children who fall behind are less likely to catch up, and they tend to remain behind throughout grade and high school. All right. This is about book deserts. So there was a study in Philadelphia showing that in some low-income neighborhoods, they only have one book for every 300 kids. And even in those cases, they were counting coloring books. So just statistically speaking, if there's a family with lower income, 61% of kids in those families would have no books at all in their homes. 37% of kids will arrive to kindergarten without skills necessary for lifelong learning. 50% of kids from communities facing barriers to progress enter first grade up to 2 years behind their peers. And 68% of America's fourth graders read below the proficiency level, with 82% of those kids being from families, again, with fewer resources available. So this impacts most of my patients, really. So the importance of a home library. So having books at home has been proven to show a positive benefit in a myriad of ways. There was a 2-decade-long study that found just having a home library present increases child's academic success, their vocabulary development, their attention span, and concentration, and later on their job attainment. The study also showed the difference between being raised in a home with no books compared to having a 500 book library has as great an effect on their level of education later on compared to having parents who is barely literate or early literacy, just a few years of education, compared to having parents with university education. So the presence of books really, really matters. And this reported that the child, in either case, if you have 500 books at home or parents that have been completed university, they would reach 3.2 years further in education on average. So I'm preaching to the choir. You guys probably know some of this information already, but how do we reach those kids who are in need? So first, we need to recognize the many different kinds of needs that we see. So there's not going to be a one-size-fits-all solution to this because of that. So for instance, these are different types of families that I see: children and families with emerging or limited literacy. How do we, if I can give them books that are in English, is that really the most helpful thing to do? Children in multilingual families that we want to support that the multiple languages that they know. Children with autism spectrum disorder or neurodiversity, what's the best way to reach them as far as literacy goes. And then children in foster care or unstable placements. We need resources that can follow them. And then children with conditions leading to frequent education disruption, like hospitalizations. I forgot to mention that's a significant patient population of mine, is kids with really significant medical conditions where they're absent from school or need home hospital quite often. They tend to fall behind pretty quickly. All right, so first, some concrete steps. We need to increase awareness of ways that they can increase their literacy, the importance of literacy, again, the norm in the majority of the world is to kind of wait for your child to be big enough that they can go to school, and that's where they're going to learn all the stuff. And the emphasis is not so much on home education and home literacy. So we have to do a good job educating them about the importance of talking, speaking, hearing lots of words really early on. We need to make sure that they know about free public libraries. Again, for my refugees, I'm talking to them about this. I'm helping them find closest ones on a map, for instance, and helping them get connected in easy ways. Second, we need to have more events that can bring the libraries to their communities. So rather than this being just a stationary place, an example I have is one of my kids is in a rainbow club, and there's a librarian from the library down the street that brings a cart of books that are chosen specifically for this population, that are very inclusive, and even allows the kids to check them out right from there. So I thought that was a really cool example, and I feel like I haven't seen as many examples of that. And then we also need to help enroll our families in free book programming. And so at the clinic, I have flyers that I give out regarding the Dolly Parton Imagination Library. We're in the Louisville area. All of our zip codes qualify for getting a free book delivered to them every month. And then free online book resources as well. For instance, the Bloom Library, which is online, has its own app, and it has a lot of multilingual resources. All right. So thank you. How can pediatricians and healthcare providers increase access to books and literacy? Well, pediatricians, again, education is really important. We also educate on the importance of play, doing things together. Mainly limiting screen time is a really important step. We also educate on the availability of these various resources I mentioned, and get them connected. Sometimes that's a manual process. If I've got a flyer and a QR code, and someone who's never seen a QR code or never used a QR code before, I will ask them for permission to use their phone and take them to the website and explain how to use that resource. And then there's, as far as in our offices, another program that we have is called the Reach Out and Read program. I don't know as many details about how exactly you get connected with this particular program, but we have it in all of our general pediatric clinics with the U of L related academic programs, where we give out a free book. The Reach Out and Read program, I think generally usually goes from age 0 to 5. But for our clinic, we actually get extra books and give them out all the way up to age 8 years old. So that's just another way we can build up that home library. We also host book drives. We offer free donated books that are on a separate bookshelf compared to our Reach Out and Read program. And we do social determinant screening at the clinic. So if there's a family who screens positive for having more needs, they're more disadvantaged socioeconomically. If they need food, they need clothes, they need diapers, they also need books. So we make sure we take the kids over to pick out some books before they go. Other ways that pediatricians and healthcare providers can provide access is having flyers. So again, I have flyers for all of these programs that I hand out for folks who have the literacy to use them. And then how do we connect them with those resources? So like I mentioned, manually, but also we can use our community health worker who may not have the language barrier, may understand their background a little bit better and how to help the family understand the importance of using this resource and just physically how to use it. And then we can also host outreach events. All right. How can librarians partner with pediatricians? So I mentioned not every pediatric clinic has a reach out and read program. So you may want to check with pediatricians near you, or family medicine practices especially may have even less resources geared towards kids. So check in with them and see, do you have a reach out and read program? Would you like help getting that set up at your clinic? You can find out, if you know your population that's near you best, you may be able to help tailor books, ones that are either new or the tried and true kind of favorites, but you can help tailor the book needs to that population that you serve. As far as some examples of connections, one connection of mine started a couple of years ago with a new library program coordinator locally at the Iroquois Library. Ahmed Farah, he was able to attend our refugee provider meetings, and together we, discussed like the needs of our youth locally. So we talked about with COVID pandemic, there was increased isolation, more kids coming in mental health crises. So he was able to kind of tailor the programming they were doing at the library to meet those needs. So they were able to get more connection, at least online, although they weren't able to do the events in person as much at that time. And he's also a great just contact. So if I have a family who's hesitant or not quite sure what to do, someone to kind of help hold their hand and introduce them to the public library system. And then our moderator today, I met Amy at the Immigrant and Refugee Inclusion Summit over the summer. Shared some of my struggles with literacy for some of my special patient populations. I have a number of kids who have limited hearing, actually. And so because they have limited hearing, they have limited language, both folks that are born here in the US and abroad. And so she was able to get me some resources right away on ASL specific learning for various ages, and then got me connected to resources and people who could help me with resources for Rwandan Sign Language to connect them. This particular kiddo, he actually had kind of limited Rwandan Sign Language proficiency, which makes it even harder for him to learn ASL. And since he doesn't also know Kinyarwanda, the local language of his family, very well, it's just been really difficult in general. So when I was able to show them the Bloom Library website, where there were books specifically in Rwandan Sign Language with subtitles in Kinyarwanda, this was our key to connecting his parents' language to his language, and kind of, helping to give them that resource to work on at home. So I think it's really worth considering these kind of partnerships if you know there are some specific high risk or unique populations near you. I'm not sure if there are other great examples of really special populations like that, but I think, even, since books can be, both a mirror and a window, we want our kids to see themselves in the books that they're reading. And so having access to books that reflect our kids is really helpful. All right. So how do you create these connections if you don't already work closely with any healthcare providers? Well, like Amy, you can attend conferences and health fairs where those relationships could just arise organically. You could kind of just reach out directly to practice leaders, like go to their website and see who's leading them and ask about any particular literacy needs that they might have. You could connect if you have an academic pediatrician nearby. A lot of academic practices would have like kind of the literacy champion, the person heading the Reach Out and Read program, for instance. You could also create flyers about events at your library, library news, any new online resources that you learn about, and just share those with your local practices that they can then give out to their patients. And then, as far as the special populations, if you've got a special population near you, try to gather collections that are specific for them and highlight these, like maybe have a monthly book club or newsletter or something like that, that you could highlight different types of people that live in your area. All right, and then the next steps for the partnerships. You know, if we know that even paying for 500 books for one kid is still not going to be as expensive as, say, 2 or 3 of their vaccines added up together. But we know that evidence shows that this book support supports education attainment, psychosocial benefits. And again, doesn't in the big picture doesn't cost that much money. We've got to let people know about it to support these early, programs. Um, so we can find community partners that make sense to connect families with even earlier. NICU programs, WIC programs I've read about, newborn units, or parenting classes. We could partner, maybe apply for grants in those ways, or better than grants, discuss this with our legislators and advocate for funding to create and support those programs for early literacy. Make this more of a right for everyone. Than a niche sort of a thing. And really, pediatricians, we love to advocate and knock on our legislators' doors, but by partnering and lending your voice as well and your time, then we would have just a more strong message, more unequivocal message that literacy should be this right. All right. In summary, and I know we're going to end early if that's okay with everybody. Early literacy is critical to reaching one's full potential. Reading builds improved attention spans, better concentration skills. It has so many benefits that I'm sure you know about. Having access to books in the home for daily reading is a great way to increase language and literacy. Programs like Dolly Parton's Imagination Library, Reach Out and Read, online resources, increase access to books for young kids in addition to the public library programs. Partnering with pediatricians is one way that you can reach more children, especially those that are living in book deserts or at the highest risk of language delays for a variety of reasons. And really, we've got some more work to do. We need to advocate together to, get books to be a right for families and young kids. All right, I've got some resources. Does anybody have questions?
I suspect people are typing. So while we're doing that, I had mentioned at the beginning before you started, while you were signing on, that there's a lot of us that have tried to connect with our local pediatricians, and they're often so busy we can't get past the receptionists. Do you have recommendations on how best to connect? I know everyone's different and all that, but perhaps you could speak to helping us get beyond the receptionist.
Yeah, that's a good question. I think it depends on the practice because I've seen different practice setups. If they have a practice manager, I think that's the best place to start because there are a lot of different types of people that approach pediatric clinics, like vendors and things like that, which, they're sort of there to defend us, like our first line of defense to keep them out of our office and from, providing patient care. So I think connecting with the office manager would be able to get you to the right place, get the right message across of like, hey, this library wants to connect to help you give more resources to your patient. We would love that. I don't know any pediatricians who wouldn't, love the help.
Well, that's encouraging. Other thoughts, guys? And just what about the larger organizations? How would you recommend are there committees you guys have that would benefit from having librarians from it? I guess how do we get libraries even on the radar? Beyond the pediatricians so that others are looking to partner with us too.
Right. Yeah. And especially for this early childhood level, right? It's easy to reach kids once they're already out of school, but by then the damage is sort of done if they haven't had access to books. Yeah, so that's a good question. We do have committees, like there's the American Academy of Pediatrics, for instance. I know Family Medicine also, have organizations. As far as who's involved with the organizations, though, that's the part where, I don't like I'm part of the AAP. I'm on, the Immigrant Child Health Task Force, for instance. Um, it's a relatively small number of people in leadership and participating regularly with the AAP in Kentucky compared to, I'm guessing there's probably more local organizations. So I would maybe start with the larger sized practices. And if you can connect with someone within a larger practice or a larger group of practices, since most most medical offices are sort of being absorbed by larger organizations. If you can find the right person within the organization, like I said, to be sort of that like literacy champion, I think your message would get disseminated the right way.
And you've mentioned literacy champion a couple times. Are there pediatricians that identify themselves that we could search that way online?
I doubt it.
Probably.
Yeah, like for me with our practices, like I said, I'm with the Norton and U of L like academic programs. Like we have someone, it's not me, who's like our literacy champion. And by that, I mean like they're choosing, our books for the Reach Out and Read program, and in charge of like ordering the books and things like that. For our clinic, we ended up choosing different ones, to better meet the needs of our kind of special populations. But um, yeah, I don't know if that's something that would be searchable. And then, I mentioned health fairs and things. Again, it's kind of a sliver of people that, make the time in their life to go and volunteer at health fairs too. So again, those might be a good people to connect with. I think it's still worthwhile to figure, if you see that there's a free health fair going on, to show up and see, is there a practice or a practice manager, or some representative from the practice that you can connect with directly there. Has anybody like actually like shown up to the office and still been turned away? I wonder if that would happen. Dang, that seems really frustrating. Yeah, because usually, unless I'm like not there or like in a patient room, I would still meet with somebody if they showed up in person for sure.
It makes sense. It's not medical specifically, and just time. So you guys slam so many patients into such a small time, and are just are so kind of caught where you just have to bounce from one to another, that an interruption could mess up your afternoon. So I get that. I mean, that makes sense why they're protecting you. That's their job.
But another thing you could ask about is administrative time. So
Mm-hmm.
most physicians have administrative time like carved out and protected for themselves. Some people, spend that time at the office and some don't. But that would be something like the practice manager or front desk person could tell you, hey, their admin day is on Tuesday. Why don't you check back in? Or here's, the phone number to call and see if they'll talk to you then.
That's great. That's really helpful. Any other questions that have bubbled up now? We're getting some real useful hints here.
Yeah, and I'm happy to share my flyers that I've made. I said I see the need for these sort of things all the time and throw them together. So
Mm-hmm.
I've got like for the Bloom Library QR codes, and the translation for free online books in those languages for Swahili, Kinyarwanda, Dari, Pashto, Burmese, Nepali. It is fairly specific. Not everybody sees these kids, so I'm
Mm-hmm.
not sure. Depending on where you're located, it might be a little bit different. I just gave a refugee talk a couple of hours ago, kind of about how different refugees are resettled, unevenly across the US. So if you're in a different state, for instance, you might see a lot more people from a place that I don't see very often.
Well, Nicole, thank you so much for sharing with us, and for giving us your contact information and just being here and prepping for this. This has been really, really helpful. I I hope that well, I just know people are going to take this and get out there and make appointments with the office managers or find out when the administrative times are. So thank you for all of those hints that you gave us. And like I said, most especially for coming to meet with us, and so we could learn from you and even the questions on which to ask. So that was great. Just as a wrap up thing too for us, I just need to give a shout out here to the Institute of Museum and Library Services. They funded services that we do here at KDLA, including doing this conference and also just being able to hold these sessions. So we actually are done for the day. We've had a very long and just robust day of learning. Tomorrow we'll start again at 10 o'clock at Eastern Time and 9 o'clock Central. And the links will all stay the same. There'll be rooms 1, 2, and 3. And I hope you guys go and have a wonderful and enjoyable evening. And again, if there's things that you didn't get notes from any session, shoot me emails and I can connect you with the presenters, or I may even know the answers myself. So thank you guys so much for being here. And again, Nicole, I don't know if you saw the chat, but you're getting people saying thank you and really appreciating it. So just thank you so much for your time. And
for having me.
Absolutely. Have a really good evening. And I'll say goodbye to everyone also. And turn off the recording here. And I'll stick around in the room if anyone needs or